Yeah. Yeah.
Good afternoon and welcome to the special council meeting to order. Council of under 7 and more don't provide their regrets. Let's begin with the land acknowledgement. We acknowledge that Stratford is positioned on the traditional territory of the Haudenosaunee, the Anishinaabe, and the neutral and the wandering peoples. As we gather, we are reminded the city of Stratford is situated on treaty land that is steeped in rich Indigenous history and home to many First Nations, making it the Inuit peoples today. We acknowledge that Stratford is situated on land that was shared between the Haudenosaunee, the Anishinaabe, and the neutral and wandering peoples. We are grateful to have an opportunity to live, work, and play on this land. Let's pause for a moment of silent reflection. Thank you. Please allow me to read the respected Stratford statement. Corporation of the City of Stratford is committed to providing quality service to all members of the public, council, and our employees. Our goal is to promote a safe, healthy, respectful, inclusive, and positive environment. We have a responsibility to treat people with respect by creating safe and respectful spaces. It is the city's expectation that all present will be respected. Madam Clerk, the meeting is yours.
Your worship, item 2 is declarations of pecuniary interest. Are there any declarations? And if so, please state the general nature thereof.
Seeing that.
Item 3 is adoption of the addendum, and there is a motion that the addendum to the special agenda at council dated July 20th be added to the agenda as printed.
Thank you. Moved by Councilor Burback, seconded by Councilor Nigel. All in favor? Opposed to any? That's unanimous. Carried.
Item 4 is hearings of dedications and presentations, and item 4.1 is the United Housing Report Social and Financial Cost of Non-Permanent Shelter System for Addressing Homelessness. And there is a motion that Kathy Basilakos, Vice President, United Housing be heard, and that United Housing Report be received for information.
Thank you. We've gone through that item. Thank you, Councilor Burback, seconded by Councilor Bristol. All in favor? Opposed to any? That's unanimous and carried. And welcome. Floor is ready.
Thank you. Thank you for having us this evening. So I just want to begin with a little bit of history of why we started to collect some of this data. When we started, United Right Group Huron started United Housing in November of 2023. And over the years, we've been asked quite often why we aren't doing a tiny shelter community. And why aren't you doing something like that in Peterborough? Why aren't you doing something like that? And so, for those of you who know a little bit about how the work happens at the United Way, and so Research and Planning Council, with which is its data arm, we often will reflect on the donations that we get and the investments that we make in our community. We want them to be rooted in an evidence base. And that evidence base is both looking at our community committees that give us information back, including people with lived experience, but also looking at the data and what it tells us. And so this really started as an exercise for us to be able to actually justify that we were putting money into the acute crisis through the connection centers and through some of the services that we provide with our supportive partner, but also in actually understanding that we were going to start investing in permanent affordable housing and rental housing, specifically through United Housing. And so if you go to the next slide, what we started to collect, we started with a 2 or 3 projects. Can everyone hear me? I was told to project. I'm hoping they're loud enough. Okay. So we started with 1 or 2 or 3 of these, and I just started to build a list of what the reported costs were. And what we found was that the initial capital outlay is quite small compared to permanent housing, but that the annual operating costs can be quite high. The operating costs at the low end were quite often early projects that are in the city, where there were a lot of volunteer hours, a lot of donations, and not as much in providing sort of those intensive supports that you often find. What we found is over time, these projects and these interventions are getting more and more expensive. For example, I would say the examples I would use are London, which is one of the most recent additions, and also a Better Tent City, which recently got volunteer group that organization has folded, and municipality is thinking of taking it on. But the costs associated with running it are $120,000 per person, and that's operating costs on an annual basis. So over time, even though some of those lower amounts seem low, the most recent projects, those costs are escalating. And so the next slide, if you could look at, we have a couple pieces of information, and I didn't want to smush them together because they were actually looked at differently. But this is from a 2025 report that looked at the cost of supportive housing. So that's providing people who are experiencing homelessness, providing them housing and then background supportive services that they need. The operating cost of that is roughly equivalent to an emergency shelter and far less than some of the other actual interventions that end up being required when people are finding themselves chronically homeless. The other piece of information that goes with this is the ability of somebody to attain housing and retain that housing and get off of the cycle of finding housing, losing housing, finding housing, losing cycle housing, and then extending their periods of homelessness. Supportive housing is the one system that the one intervention that works the best. Shelters, emergency shelter systems tend not to be as effective. And so the other piece of data we have looks at a similar, so the next slide, looks at a similar sort of set of housing or temporary housing, but it looks at nonprofit housing or community housing. That includes not-for-profit housing, it includes cooperative housing, and it includes the social housing portfolio that the city of Stratford, for example, as the consolidated service manager would have. Non-profit housing is by far the least expensive intervention. But not only that, I would argue also it is the one intervention that is upstream of everything else. So if what you're trying to do is prevent people from becoming homeless or preventing people who find themselves homeless, but you rapidly rehouse them and ensure that they keep their housing, you would make investments in social and community housing and co-ops, much like the provincial and federal government did 30 years ago. So that's just a little bit of background. So the next slide is also, Finland is a really great example that decided to go the permanent supportive housing route. The system that they chose is at housing first. And in this, what they did is they did an initial large investment in social and non-market housing. And what they did was they took people who were currently in their shelter system, they gave them housing first, and at the same time they provided intensive supportive services to them. Finland almost went off to effectively zero chronic homelessness in a very short period of time. I would also like to point out that even though the initial costs were very high at 300 million euros, within about 7 years, the cost savings to the system have been recouped. And the part that I always will point out, the harms of continuing a homelessness crisis, where all you're doing is emergency services, accrue indefinitely. The benefits or the savings of doing a housing first or intensive supportive housing system accrue indefinitely. And that is just the cost, just the financial costs. That doesn't actually even take into account the human cost, which is, I would argue, the most important thing. So that it was a really interesting study out of the UK, where they actually put it on quality of life for individuals who have gone through their Housing First program. And not only did they say, our community and our government saves this kind of money, this is the value to individuals and their quality of life when we give them the dignity of having housing and providing them with the supports they need to be successful. And I think that's the other part that I want to remember. And I used to be on council, I used to do a lot of things, but what I used to do was a long time ago was drug development. You never are allowed to test a drug against nothing if there is an effective treatment. You never prescribe a drug that doesn't work as well as another drug that exists. That would be considered unethical. So if we know the permanent supportive housing, and if we know a housing first strategy is what works, and that's what the evidence would say, then expanding a system that doesn't work as well should not be on the table. Difficult as that is. So the next slide. So here's the thing, our paper does not advocate for the elimination of existing emergency shelter spaces. That would also be unethical. The point is to use the two systems in tandem and in parallel so that you can over time transition to a place where you don't need those emergency services. So there is a little bit of like to read paper that went with this, right? And we are not advocating that. There will also continue to be a need for emergency shelter spaces. There's no way of getting around the women who are escaping into the partner violence and their children will need somewhere to go. And they will need to go somewhere quickly and they will need to go somewhere to be safe. The same with youth, right? There will always be a need for some kind of a temporary emergency system. But that should be in the context of system change that rapidly rehouses people and provides them with services that they need within the context of it. So next slide. So what we are saying is that we have to double down on the housing first model or a permanent supportive housing model. It's semantics like a rose by any other name, right? And moving away from the transitional housing system, moving away from it doesn't mean eliminating it. Next slide. So it's cost efficient. It has value to the community. And it reduces homelessness. And it also is about human safety and well-being. And I will remind you, I'm not talking about public safety. I'm talking about human safety and well-being for those who are experiencing homelessness. The rest of us are fine. That's the slide. It may not be my employer's opinion. Next slide. So emergency shelter expansion. Remember, I was thinking about expansion. It has an increased cost. Shelter demand continues. Individual harms can accumulate, and there's little long-term change quite often in that case. Housing first and supportive housing, the cost declines over time. The shelter system use will decrease over time, which is what we want to see. That should be our end goal. Housing stability increases, and I think it's really interesting. The early data shows that housing stability increases, but it didn't show a whole lot of like evidence around somebody, are they able to manage their system use or their substance use and those kind of things. Newer data actually shows that it actually has all of these other effects as well. And also the community benefits growth. So, and next slide. So there are some recent things that are, I think, are really interesting after our paper. We brought it out. One of the most interesting, there's a paper from a professor at Western where they said better than nothing. It was a scoping review on tiny homes and sleeping cabins. And they looked to see whether there was an evidence base to support them as effective, and they couldn't find one. So I think that's interesting as well. So next slide. So we have some conclusions that we would like to present to you as the public and as policymakers. We need to build more affordable housing, including supportive housing. It's more cost effective and it's more humane and ethical, I would argue. The next conclusion is you need to maintain and provide moderate improvements to the shelter systems. You don't need to build a new shelter that you need to continue to support. the shelter systems that you have until those other interventions come online. And for every new dollar that you spend on a shelter system improvements, you should be spending at least $5 instead of $6 and $1, $5 on affordable and supportive housing. And that's what I mean by these are, it's not either or, it's one and the other. And I've heard a really interesting, earlier today, there was someone speaking about civil society. And when you're in a crisis, is this the time to be talking about system change? And she said, it's really easy in a crisis to count children fed, to count people, emergency shelter nights, to count meals served, to count the emergency response. True system change is harder because you're counting when nothing happens. So if we move towards a system where we actually do a system change and get to a point, then I think it's sort of like the Finnish model where what happened is they did this big intervention. They reduced their homelessness down to 0, and now you have some of the government pushing back on some of that money, and their numbers are tipping up again. Because, and it's sort of also like public health, and public health does this job, nothing happens. And then we forget what public health is spending its money on. So we have to be really, really careful that once we go down that road of doing what's needed in terms of a system change, so that we prevent people from becoming chronically homeless, you can't take yourself off the gas, because it'll backslide further. Like, and I don't, oh, yes, thank you, and I'm done. Thank you. I don't know whether I was on time. But I'm happy to take any questions.
Questions at this time, is the council. Council Glisco.
Thank you for the presentation. I think it echoes a lot of what our director and many of us other people have been saying, but it's great to have some concrete comparators as well. Very, very helpful report. The one piece I just wanted to go over the transitional piece and moving. I mean, so much of this is definitions and everything is very shifting all the time, because there's some that would argue in some schools that supportive housing doesn't mean a housing first model, and we have a lot of those things are different. So not worrying about the definitions per se, but I think staying to move away from transitional, there's a piece missing in that. And I know that a lot of certifiers don't want to get into the discussion about readiness for housing because it's viewed as undignified. However, I think where we've seen, especially in the Finnish model, that readiness for housing was a huge component of why it was so successful. And I actually think it is more ethical to have those operations and programs, and transitional often provides that role. And I think we talk a lot about the costs of like the day-to-day operations and yearly operations, and we're starting to shift to those more outcome-based, that how many are actually being housed, remaining housed, and those are the data points we actually need to start looking at. But I think with the transitional piece, I wondered if you could just speak to the readiness for housing component with the housing first component, and how we as a city can address some of them, because that is such a multi-level issue.
Yeah, and so it is a little bit of it is a semantics, right? So it's kind of, so the thing, traditional transitional housing, which was very restrictive on, you know, it's a 6-month program, you can only stay for 6 months, you can only transfer that kind of like that shifting away from that kind of a transitional model to housing readiness, which doesn't have it doesn't have a prescribed time associated with it. It doesn't have, so for example, Dunhouse in Toronto, it's considered burn supportive housing. That doesn't mean all of the residents there are there forever, but they're there as long as they need to be. And I think that's part of what is that this becomes a continuum, and an interconnected continuum is individualized and what the individual needs, as opposed to prescriptive sort of programming around these things, right? And I think that's what, and what I'm trying to sort of like remind everyone is that all of these components will have a place, right, in a coordinated system change. But we have to be ready to move away from some of that programming that hasn't been shown to be effective. But that there will be housing readiness and transitional housing programs that will change over time and will support more of a housing first or permanent support housing. You know, it's again, it's semantics, But it has to flow together in a way that meets the needs of the individuals that are accessing those services. And that's just a long and complicated way for me to say that we'll probably all need a lot of different bits and pieces of this. But the main focus should be permanent supportive housing. And that's a very difficult concept, because honestly, permanent supportive housing, like my niece uses a wheelchair. She has permanent supportive housing and not a single person would ever tell her, in 5 years, you're gonna be done with this and then you're gonna move on. So we have to accept that some people, regardless of what's, underlying reason they need permanent supportive housing, they need it permanently, and that can include people with substance use disorders, people with mental health disorders, people that have trauma. This shouldn't be time limited, right?
You follow up, first time.
Thank you, and I know this was outside the scope of this specific, but I'm just wondering in the course of the research if anything else came up, because I know working in the space, one thing that we find a lot is what we sometimes call is kind of funding chicken. When it comes between capital expenses and then the true services, which actually deliver the systemic change that you're advocating for, that we're all advocating for, that a lot of times upper levels do not fund services until there is a significant, if not completed capital project, and then that leaves them very vulnerable, and it makes especially budget conscious municipalities quite hesitant. If any of your research revealed that, especially if that means perhaps some of the stagnation we're seeing in other cities that have implemented these smaller and kind of variations on emergency shelters, if that was a
Yeah, I mean, part of this is the challenge. This isn't the responsibility for municipal government to deal with. Right? We need a national housing strategy. It's an actual national housing strategy, right? And not a way to access some capital supply, right? It has to be an integrated national housing strategy that includes the provinces in dealing with the part of just the supportive housing piece of it, right? It doesn't work if all the different components aren't there. That's just the reality. And that's why Finland was able to make it happen, because they invested heavily in the capital portion of it and also heavily in the supportive services piece of it. But it's no different than the hospitals that waste $35 million for an MRI, but then you can't cut a ribbon on the technician that needs to run that. And we're stuck in that same sort of hot potato of different levels of government, and until you can get everyone sort of doing their part that they're responsible for, it's challenging.
Thank you, Councilor, go ahead.
Thank you through the chair. I was gonna ask you about whether you were to take this presentation on the road to the province and to the federal government, please. Because if they were the ones we'd really love to share this information with, so that we can all get on the same page. But I was going to ask as well, I know United Housing has a supportive housing project in Stratford coming up. Are you able to share any more details about that?
So I want to be really very clear, right? United Housing is a housing provider. We do rental housing, and we're a housing provider. We work with agency partners who provide supportive services. So those are great. So I just want to I do hard hats in building apartments, and then we have MOUs with our partners providing social services. Everybody knows we've all had, but straight we've all Molly's. We will be doing commercial on the main floor, which will be social and community services, and then there'll be 9 units of housing above it, and we're hoping that would be transitioning to part of it. But the other part of it is by principle, we don't create silos. So all of our buildings are mixed use. So we mix or incarcerated based income as well. So we have a third degree affordable, third what we would call attainable, a third market, and supported services, and we don't differentiate between different populations that way. Our first operating building we have in this fall will be like that as well.
Anything further from council?
Oh yeah, stay tuned for the Molly's more to come.
Councilor Henderson.
Always learning something new, council. With the mayor. Have you looked at the model that Innoville does?
Yes, and what are your thoughts on the? Oh, Invol's is, I mean, Invol was kind of when United Housing, well, before United Housing started. And the United Way did a feasibility study to see what was needed, and it came back, they said we needed a region wide. Not-for-profit housing provider, Invol was one of the organizations that were approached, possibly to come and serve that purpose here, but they tend to be larger market. Community, yeah, I think it's interesting, I think. I did a tour, you were on that tour, yeah, a number of years ago, I thought it was interesting. I think it's interesting that Invol has actually started a non-profit housing division now as well. So that not only are they doing supportive services, which is what they were focusing on, now they actually are doing community as well. And I think those two have to go together. And one of the things, I mean, personally, the fact that they had only supportive housing and it wasn't a mixed, like I'm used to, Toronto where people who needed supportive housing were in the same buildings with people that didn't need supportive housing. It was a much more sort of like mixed sort of community, that I enjoy. So I'm not sure that I'm as keen on the model where you silent people by needs, but that it works really well and they're doing good work. In terms of your thoughts on that?
Any other comments, Councilor B, and then. Go ahead.
Oh, thank you, Mayor. Thank you for the article or report. It was, I feel like brought a lot of clarity to things, and as I've been in this role, kind of learn all of this, I toured like about 5 different municipalities and they've all done certain things. And every one of them point to this is the reality. And most of them chose the other and have regretted it. So I just feel like the more that we're gonna start gathering money or saving or trying to put our efforts towards something, I don't wanna go into all of the things that we know fail in all the other municipalities that have tried them. Let's not repeat that. So this brought a lot of clarity for me and I really appreciate it. Thank you.
Councilor B.
Through the chair, great report and great information for us to have and clarifies a few things, certainly for me. There's the other part of this, which is when we are looking at emergency shelters, the costs that aren't really captured there are the work-based services, healthcare, that also add to a significant cost to the municipality and to the government for providing those services. So it's probably more substantial the savings of producing supportive housing and than doing that. Is there somebody who's advocating based on that information or providing that?
So I actually have a healthcare primer on costs to the healthcare system of homelessness and that are directly related to being homeless. I can share that with you sometime. But yeah, there are people. I'm certainly in Toronto, the School of Social Medicine and the Dunhouse Project. They're really like what's the word, really drilling down on the costs that are certainly in the emergency room, but then also in the admissions. People that a lot of the day, people who are experiencing homelessness, their stays in hospital twice as long. Their outcomes are poor, and quite often it has nothing to do with like it's things that happen that are secondary to this, right? So and then the policing costs, there are some interesting pieces that there's a study on veterans that actually looked at some of the policing costs, but all that data exists. Canada has pretty good data on it, right? I still say the most important one is the quality of life of the people who are experiencing homelessness and the value to their quality of life. I think that's the one we should focus on, really.
Other comments or questions? Councilor Bristol.
Thank you for the chair. Just on the topic of costs, I think we should also talk about the political costs and community costs, that when interventions don't produce the results as promised, the dramatic political costs on any type of housing in that spectrum that are felt. And I know we've had projects that are true supportive housing and have faced 3 to 5 year delays working through, much needed, but very prolonged and at times very acrimonious political consultation. We've had projects go from 10 million to 30 million and now no longer viable because of that, even though because of the misunderstanding between the variety of services. But I think that's cost as well, we have to be cognizant of that not only are they not producing the outcomes, but the downstream effects on the actual solutions as well, are really, quite detrimental and just further delay.
Yes, and I would argue a little bit of it is political will on, like, I think in Vancouver, and I think there's a lot of activity around the British Columbia decided that they weren't going to actually concentrate all of their supportive housing in one area of the city, that every community in British Columbia was going to participate in the permanent supportive housing that's needed to actually do homelessness. That caused a lot of problems with people who live in this land. But that the solution that we need needs to include everybody participating, right? And the political will to say this crisis is more important than the non-existent impact on your housing values, which 24 out of 26, whatever, right? That we have to be able to have this conversation with the public. They're hard.
Any other comments or questions? If I could just add, thank you for your work and the report and the presentation. Certainly, I had an opportunity to visit Finland twice, last summer and 3 years ago as well. To see in the mid-80s, they were sitting at 20,000, and everything's relative, 20,000 homeless individuals, single individuals, and now down below 3,000. Certainly requires a huge federal vigil. In that case, was federal government saying we're in. And based on the idea of housing first, getting people housing ready. And the other piece that I thought, I went on a tour and they said, can you identify who in this building is being supported? And you can't. They're part of the community. And so all those things are bore out in your presentation here today. We thank you for that.
Thank you for having me.
Next item. Clerk.
Through your worship, item 5 is order of the day. Item 5.1 is the overview of the 2025 to 2026 warming center operations. As noted on the agenda, the Director of Social Services and the Manager of Housing are here to present the report.
Thank you.
So good evening, Mayor and members of council. The report before you provides an overview of the 2025-2026 warming center operations and seeks direction on continuing this service for the 2026-2027 winter season. I want to begin by acknowledging that a warming center is not and cannot be a long-term solution to homelessness. It is a temporary, seasonal safety measure. The long-term solution, as we just heard, remains permanent, deeply affordable, supportive housing combined with the prevention, stabilization, mental health, addiction, income, and community supports. At the same time, while that longer-term solution, and as we continue to work towards that longer-term solution, we have an immediate responsibility to help keep people safe during the winter months. For individuals who are unsheltered, extreme cold can be life-threatening. The warming center provides a warm, supervised indoor space with meals, connection supports, and an additional option where people have nowhere to go. During the 2025-2026 season, the warming center operated for 134 days, including 19 extreme cold weather days. It supported 62 unique individuals and recorded 2,825 guest visits, with an average of 21 people attending overnight. Those numbers demonstrate that there was not a theoretical need. The service was used, and it filled an important gap in our winter response this winter. As the Consolidated Municipal Service Manager, the City of Stratford is the lead for housing and homelessness services across Stratford, Perth County, and St. Mary's. But homelessness is complex, and no municipality or agency can address this alone. This work depends on strong partnerships across our community. I want to thank CMHA Huron-Perth, the local, the Stratford General Hospital, Perth County Paramedics, the Stratford Police, and my fellow city employees who did work the front line and do continue to work the front line every day with people experiencing homelessness, mental health challenges, addictions, medical needs, and crisis. These partners provide critical 24/7 care and emergency response to our community, and the Warming Center helps take some of those service delivery pressures off the hospital and police and her paramedics specifically by providing a safe, supervised space where individuals can be directed during the winter months. I also want to acknowledge the many supporting partners who continue to help advance our goal with the 10-year housing and homelessness plan, including the council churches, the United Way Perth, Huron Perth, the housing providers, our outreach workers, and community organizations that contribute to their time, their funding, their space, their expertise, and their compassion. The Warming Center is one part of the broader response. It operates alongside emergency accommodation, outreach, the Connection Center, supportive housing initiatives, community housing, and longer-term housing development work. It does not replace the need for permanent housing, but it does help reduce the harm while we continue to build and expand those longer-term solutions as our needs grow. The recommendation before council would allow the Warming Center to operate from November 1st, 2026 to April 30th, 2027, with improved planning, staffing, and coordination. At this point, I'd like to invite our funding partners, CMHA Huron Perth, who operates the Warming Center, to speak about last year's operations, the individuals they served, and the frontline experience of delivering this important service.
Thank you. I'm a softer speaker. Can you hear me okay? Yeah, okay. My name is Molly Smith. I'm the Senior Program Director at CMHA Huron Perth. I oversee all of our client-facing programs and services. And this is Tanya Hapke. As part of her portfolio as a program manager, she oversees the Connection Center and the Warming. So first, I just want to thank you for inviting us to speak today about the Warming Center and the direction for the next winter season. We echo with the Director of Social Services and also with Ms. Vasilakis from United Housing have said, in that a Warming Center is not a long-term solution to homelessness. It is a means of providing safety and shelter from the elements. We too understand that long-term solutions are rooted in permanent, supportive, and affordable housing, providing intensive community supports to create housing stability for all in our community. As an agency, we support recovery and wellness for individuals related to their mental health and or addiction-related concerns, and know that housing stability is a foundational component of one's wellness and recovery. As it is in many communities, we have limited emergency shelter options, so having a low barrier option like the Warming Center has been very impactful, particularly for individuals released from hospital or incarceration and who otherwise have nowhere to go when they're coming back into the community. Because of this low barrier support option, we were able to support several new individuals who accessed the Warming Center and who had not previously accessed the Connection Center programming during the day. As with the Connection Center, the Warming Center allowed for easy access to support around basic needs and created further opportunities for participants to build connection and trust with service providers, supporting their journey towards housing stability.
This emergency support and safety provision for some of our most vulnerable community members was particularly apparent during an ice storm this winter, where many services and businesses were closed and without power. While the Warming Center was one of those locations that lost power, we were able to act quickly using emergency protocols to ensure that we could safely remain open, supporting individuals through a severe winter storm that otherwise may have resulted in injury or need for medical assistance. In conversations with our community partners, we have heard a number of anecdotal stories about the positive impact of the Warming Center on our community. While a formal report is not yet finalized, our partners at Stratford General Hospital shared with us A noted decrease in cold weather related injuries they treated during the period of time the warming center operated this past winter. We're proud of the success of this past season and feel well prepared to address the challenges we faced during this initial operation. During this past season, we noted an increase in behavioral escalation within the space. Based on our assessment and review of internal incident reports, we note that this was largely due to two factors: the increased hours of operation, and the need for greater staff and training and experience working with individuals who may present with challenging behaviors. During the warming center season, our hours of operation increased from 5 hours a day to 19 hours daily. We anticipated some increase in behavioral escalation due to this significant increase in operation within the space, and have similarly seen a significant reduction in these behaviors since the conclusion of the warming center and return to our connection center only operating schedule. In response to the need for further staff training and experience, we worked closely with our staff to debrief incidents, better understand presenting behaviors and appropriate engagement, and similarly supported involved participants around expectations to ensure safety while accessing the space. If council accepts the recommendation from the Director of Social Services today, we will be able to ensure that staff are in place early in September to begin training and engaging with Connection Center participants, practicing risk assessment skills and building rapport with the people we support all year round. The warming center was a safe space for some of our community's most vulnerable citizens, where previously they may have felt the choice was between an unsafe indoor space or being outside in the elements. Again, we thank you for the opportunity to speak with you tonight about the warming center in the 2026-2027 winter season.
Thank you. Are there any questions from council at this time from executives? Councilor Briscoe.
Thank you, through the chair. Thank you for your work and continued work with, and to our department as well for all your continued incredible work. I noticed that obviously needing increased staffing, and the question I have is obviously now when we do our second year, we have a lot of lessons learned. I think even from our presentation today, I would love to see this be like a true triage as most emergency intervention would be. A triage, right, that it's meant to facilitate that trust, but then lends itself to further referrals for further connections, which then of course it was someone into hopefully more stability, and we start through that spectrum. Do we have, given the staffing and training, does this also prevent an increased data capacity with the individuals that we serve? So I think it has such a valuable opportunity to then show us what those gaps are, that what are the services that are preventing the individual from moving into more stable housing or into the housing spectrum. What is some concerns they may have for not seeking a different type of housing? Those are the data points we need to then make our decision as to the types of housing we invest in, because we talk about supportive housing as, and it is, and that's still an umbrella term because there's 1,000 different variations in that, right? That what someone needs for addiction supported housing drastically different than what a family supported housing unit will need versus just a single men's versus a women's. And so knowing the type allows us, and I think this provides a great opportunity to have that data in those capacities. Again, going into a second year, obviously that the trust component is huge for me and a real component for me for continuing with the caveat, okay, now we've established this as a potential emergency practice in our community, and have to operate as a true triage learning point that gets someone into the services and spectrum that we are also investing in and are prioritizing. Does the increased staffing give that capacity? And I know we're collecting data as well, but if we could speak to that, just so we can have this next iteration grow even more in that triage data learning capacity for us.
I think the increased staffing is for a couple of different reasons. Firstly, we didn't find the security guard helpful, as we sort of anticipated, being service providers and frontline staff. We knew that probably wasn't going to be helpful. It in fact wasn't. And the third person would allow staff, so there was multiple incidents that occurred, and when there's only 2 staff there and 2 staff are required to intervene, then what happens when that staff needs to debrief with someone? There's no opportunity for that. So the third staff allows for opportunities to debrief. We do actually collect data on all of the clients or participants that are regularly attending the Connection Center. And I would say that, in my opinion, that evidence is already there. If people have been chronically homeless for a long period of time, chances are supportive housing is the best option. So I think that data is there. I think it's just how we look at that, right? The length of time or the return to homelessness, right? So when people are housed and constantly kind of going through that cycle of being housed and then returning to homelessness, I think we see a lot of that in our community as well, which indicates that supportive housing is needed.
Other comments,
The other follow-up, was there any additional service that you felt would be kind of akin to bringing to it? I just mean from so I work in service provision, I'm myself, that yourselves would have access to other funding opportunities that we may not, that could, like, if there was a specific service attached also then to this, right, it allows for various funding to be based on services. Was there anything that made itself quite aware for yourselves for service specificity, as well as then tapping into these upper level funding?
So I've had some conversations with paramedics. I think more paramedic support. We just really didn't have a lot of time last year to plan and prepare for that. But there are paramedics that are in the evening that have identified that they can attend this year, and we've had some conversations about that. Other than that, it really is supposed to just be an overnight space to keep safe, right? When we add in too many services and too many sort of expectations of the space, then it changes everything. We've got case managers that have been doing that work for years. And so that competency takes a very long time to sort of gain the level of competency required to support high acuity individuals.
I would just add to that as well. I think the other thing, the benefit also of having a warming center space in the same space as the Connection Center is it is also relevant, but bringing in that familiarity and that trust with staff. And we do have that internal capacity to share information. So we are really encouraging folks who are maybe accessing through the night. Again, as I think we mentioned, there were some folks who accessed for the first time in the evening to really try to build that relationship and to bring them back in during the Connection Center hours, where we have really established over time that hub of connectivity and where a lot of that work goes around that housing stability and providing connection to other service providers.
Any other comments, Councilor King? I see one.
The presenter just solved my question.
I knew it.
Other comments, Councilor Hams?
Mayor, thank you for your report. Did you find like at night that you're saying there was several times there was behavior issues? How did that affect the other clientele?
Well, they don't enjoy it. That's
They
for
what?
sure. They don't enjoy it, that's for sure.
No, 100% different.
Yeah, so then, and again, that's why more staff is important, because while two people are managing that, the third person can be having conversations with other folks in the room, so that we don't have trickle down effect, where suddenly we go from having one issue to having 4 or 5.
It was interesting to read, like, people that in the past went into the hotels with the transitional housing, whatever we did in the winter time, chose to go there, and it was nice to see in the report. I've seen this myself, like if when you go for suppers. And I've seen some people there that I know are homeless or needy, and they said they go there for the community because they're not alone in their own home, right? They're older and maybe most of their family's gone, and they just donate then.
Ms. McElroy, do you want to jump in on that?
Mayor, I do want to reiterate that the emergency accommodations service of motels is still part of our response with the warming center.
Well, I know it's just that it sounds like this is a good option for people that couldn't handle staying in the home.
Yeah, well, and that's why we need to have multiple different options for folks, right? One, it's not a one size fits all because people aren't one size fits all. So, what works really well for one individual is not going to work well for
Everybody's
everybody.
unique.
That's right, that.
Thank you.
The other, Councilor Kate, go ahead.
Through the chair, just a question regarding, there was an issue with the creation of the warming center that affected one of the other shelters and their staffing last year. Is there a plan to kind of stagger the intake of the employees at this point? Just in case it does have unaccounted for effects on other agencies.
I would say, I think part of sort of in our conversations and part of our request is that if this is approved, the sooner it is approved, the sooner that we can start that process so that we can be intentional with our partners around that hiring. Again, we were aware too of those unintended consequences, and certainly want to make sure that all of the services that support people in our community are well staffed so that we can do that provision. Again, I think for us, it was a real challenge because of when we kind of knew that we were going to move forward with this, it was very much felt like a ticking clock. And I know personally every day I was checking the weather. I was really worried about, okay, when are we going to be ready and really trying to do that as fast as possible. So I think our hope in starting as early as possible is to maybe be really intentional around that. And again, make sure that we have the support we need, but we can be intentional around that hiring.
If I could just jump in there, the other thing, Councilor Kate, that the city did support is providing some equity or closeness with regards to salary so that one wasn't going to far exceed the other and then therefore take those. Councilor Burback.
Thank you. Through the chair, I just wanted to say thank you for the work you do. I know it's really not easy and it's really important. There are members of our community that really have benefited from the work that you do, both at the Connection Center, but also at the Warming Center. We did spring it on you a little bit last minute the last year, so I'm really glad to see that the length of time is going to extend and that you have more time to plan, because I think that really is important moving forward. I know that we have talked before about timing, like mornings and folks coming out of the warming center and really having nowhere else to go. Are there going to be some adjustments made to the timing?
Yeah, so that was the other piece that actually I think came a lot from our participants. So we also really wanted to be informed by not just what we were experiencing as an agency and as staff people, but also what folks around our service were identifying. So in our recommendations that we put forward, we did look to extend our operating hours till 9 a.m. I believe, because again, for that same reason that we understood that 7 a.m. is a really challenging time. And it also then reduces the time between warming center hours and protection center hours.
No, I think, that 7 a.m., we sort of knew it was too early. Who wants to get up at 6 o'clock in the morning, especially when you know you're going up to the cold and you don't have anywhere that you can be for several hours. So we did recognize that as a challenge right away. That's something that we wanted to rethink for the next year. So yeah, that's something we heard everyone about how it was. Noted.
Yeah.
Councilor Mead.
Thank you for the mayor. This would be for the right? Have you had our municipal partners show their support, or are they, I guess, in support of this as well, so they partnered with us?
They can through the mayor. Am I hearing, are the municipal partners wanting to see a 1-year extension of this? Because the answer is yes, through specifically the hospital and police, that we did reduce the emergency response. We acknowledge again, as we all right through United Housing to CMHA to the municipality, we know this is not the it is a short-term solution. It is a stopgap measure until we get the long-term supportive housing. There they continue, and as you hear, we will have multiple partners coming in to help, including the paramedics. So that it's a multifaceted approach to address things.
Any other comments? questions. If I could add my thoughts here just for a moment, certainly as a volunteer on Thursday nights, I had a chance to be at the warming center and several things were revealed to me. One, the need of the service and in a way a blessing of to our community and those that we serve this year. The other piece that I can't overemphasize is the professional and compassionate care of the individuals that from CMHA that served on a nightly basis. There were challenging moments for sure. But the relationships that were built over bridge and Hooker and Kettle Coffee were just absolutely amazing. The generosity of our community, people that brought food on a regular basis that we served as volunteers was just exceptional. Just meals that they would serve their families became a meal that they served our extended family. And the other piece, having visited the encampment today, the praise that those individuals at the encampment share about the great work of social services here in Stratford. Our people that go every day to that encampment and once again, build relationships, find out what they need, and try to do their very best. I'm really pleased to say we did something special and we continue to do something special in the city of Stratford to meet the needs of all of our residents. So on behalf of council and the residents, thank you very much for your work. We appreciate it. Next item, then clerk.
Your worship, turning to your addenda, there is a delegation request with a motion that Tanner Bergsma be heard.
Thank you. Move it from that item. Thank you, Councilor Henderson, seconded by Councilor Niger. All in favor? Opposed to any, that's unanimous and carried. Welcome to the floor to us.
Thank you, City Council, for accepting my delegation request. Tonight, I am not coming to you as a resident. I'm actually coming to you this time as a representative of the United Nations. I want to be clear. This is not a decision that even should be up for discussion in our city. It is sad to see that despite efforts, the provincial and federal governments do not do what they need to do to solve this crisis. That was outlined in the reports we saw it. But I want you to ask yourself in moments, what is the value of a human life? Because that question has been asked by the youth for a long time. The youth of the United Nations is calling upon the city tonight to pass this motion, to support the motion for continuing the planning of parks. By not doing so, it actually infringes upon national law. I would like to draw your attention to Article 3 and Article 25 of the United Nations Declaration of Human Rights. Article 3 of UNDHR recognizes the right to liberty, life, and security of a person, while Article 25 recognizes the right to an adequate standard of living and adequate housing. I agree in full support of everything I've said tonight. The youth of the UN would have backed this. The problem being is that it takes time to build support housing. It takes time to build these resources that the city needs. Where are these people to sleep? Where are they supposed to go? What are they supposed to do? If they don't have anywhere to go and they freeze to death, which is what has happened last year, the city could have been found in contempt and in violation of international law and legislation. Now, I'm not saying that has to be the case, because we made progress with the warming center last year, and we made incredible strides. But the fact that this is even up for discussion is upsetting the youth. And so the UN and the UN youth and civil society organizations are prepared to file complaints against the United Nations Human Rights Office should this motion be denied. We are fully prepared and are ready to go. I am being honest with you here. and should not be up for discussion. The residents of the city need to know and need to understand that you prioritize them before money. Again, when we think about statistics, of what we are seeing, we have seen a decrease in hospital-related ailments in regards to cold weather. The reason why we have seen a decrease is because we have had transitional support services there. And unlike some individuals, I used to be homeless, so I fully understand what it takes to get out of there. You need transitional spaces. I've spoken to the United Nations delegation of Finland. They were able to use a housing first approach, using transitional aspects and using transitional methods to help early on. Unfortunately, we are not in a situation federally where we can get the funding at this point. Okay, that's just the reality. So we need to look local in what we can do. At this point, what we can do is continue the operations of the warming center so that individuals are not having to freeze themselves, so that they have other resources to go. My last concluding point is this. The UN wants to thank the city and its partners for their hard work on tackling this issue. However, with that being said, at the end of the day, this funding needs to go through. Because if not, people will die this winter. And if not, there will be complete funding. That's all I'm saying. Thank you.
Your worship, as outlined on the agenda, there is a staff recommendation that the report be received for information. That council approved up to $327,031 for the operation of the warming center from November 1st, 2026 through April 30th, 2027, with $88,560 representing the city's portion of this to be included in the 2027 draft mayor's budget. And that staff be directed to develop a contract with CMHA here on Perth to be signed by the mayor and clerk for their designation.
Councilor Rackman, second by Councilor Dean. Discussion. Councilor Berger.
Thank you, through the chair. I just also wanted to thank the folks at St. Paul's Church who are allowing us to use that space. Without that space, we wouldn't have this program. So I just wanted to make sure we included them in the thanks. I was also thinking about possible grants, and if there was a possibility of getting some capital grants, that would also be welcome, because I do know that space is in need of some upgrades as well. So if we just can keep an eye on not only operational grant opportunities, but capital grant opportunities, I think that would be welcome by the church.
Councilor Bristol.
Thank you, Chair. Just on the grants piece, the church themselves is in the best position to capital grants. I know we support our churches across the province, and all have been successful in receiving the maximum amount through the, I think it's now phrased the anti-hate security prevention, but they do have a very specific stream and therefore security measures, cameras, and security being one of them, which they can receive up to, I believe, 10,000 towards to facilitate this, but the church themselves can apply for that, and it opens very, very frequently, if not open presently, which I thought of there as well, noticing the security cameras need, so I thought that was a good finding, certainly encourage them to tap into and users.
Comments at this time? Oh, go ahead.
Thank you, Mr. Mayor. Just one comment I wanted to make for everybody that's here. We talked a lot about the supportive housing piece, which again is not in the resolution, but just to remind the public that the city has committed $5 million to build 12 units of supportive housing. Through our partners with CMHA, we have applied for operational funding. We're still waiting to hear from the province on that. And we did just on Friday secure a delegation with the Minister of Health, who also happens to be the Deputy Premier, to talk about that funding application as well. So again, we are continuing to do that work as well as we do with that project, again, we don't have shovels in the ground yet, but we are in the, building. Design stage and planning stage of that, project.
Thank you. Any other comments before I call a question? Seeing none, all in favor? Close the debate, that's just on the same here. Thank you. Next item.
Item 6 is adjournment to closed session, and there is a motion that the council meeting moves into closed session to consider the following matters. Item 3.1, confidential report of the chief administrative officer with respect to the proposed restructuring of Festival Hydro. And that's considered the advice that is subject to certified privilege exemption. And item 3.2, confidential report of the chief administrative officer with respect to the proposed acquisition of 1052 Wright Boulevard. As to be considered under the following exemptions of the municipal act, proposed or pending acquisition or disposal of land. Position, plan, procedure, criteria, or instructions to be applied to negotiation.
Made by Council Dean, seconded by Council Bristol. Any discussion? All in favor? Vote today, that's carried. You will move into the citizens.
For your worship, turning back to your council agenda, so any declarations made at the closed session, they need to be restated at this reconvened portion.
Noted.
Item 7.2 is report of the camera session. So the camera session was just held, considered items. First being the comment report of the chief administrative officer with respect to the proposed restructuring of Westfield Hydro. That was considered or the advice that is subject to solicitor client privilege exemption. And item 3.2, which was confidential report of the chief administrative officer with respect to the proposed acquisition of 1052 Wright Boulevard. And that was considered under the following two exemptions: proposed or pending acquisition or disposal of land, and a position plan, procedure, criteria, or instruction to be applied to any negotiations. At the in-camera session for 3.1, advice subject to solicitor client privilege was provided by the city solicitor and no direction was given. And for item 3.2, the confidential report of the chief administrative officer, an overview was provided and no direction was given.
Thank you.
Moving to item 7.3, reading of the bylaws. There's only one bylaw listed, which is the confirmatory bylaw, requires first and second reading and third and final reading.
Thank you. We'll look at first and second. Councilor B will move, second by Councilor Burback. Any discussion? Seeing none, all in favor? Opposed to any, that's unanimously carried. Third and final, Councilor Henderson will move, second by Councilor Beatty. Any discussion? Seeing none, all in favor? Opposed to any, that's unanimous and carried. The last item of tonight's session. And I thank once again staff for your presence, your input, and council for your wonderful conversation and dialogue. Excellent. So to that end, mover to adjourn. Thank you, Councilor Nigel will move, second by Councilor Beatty. All in favor? Opposed to any, and we are adjourned.